All right. Well, good evening, everyone. My name is Dr. Joseph Brokavich. I have the privilege of serving as the Senior Associate Dean for the Doctor of Pharmacy program here at St. John's University. And on behalf of my colleagues who are with us tonight, I want to thank you for taking time out of your schedules to join us to learn a little bit more about the Doctor of Pharmacy program here at St. John's. Before we get started, I first want to congratulate each and every one of you. It is no easy task to be accepted into our program, and our program, as we'll discuss, is a little bit different than many of the other pharmacy programs that are out there in the country. But you should feel really proud that you have been accepted into our program, and we hope to see many of you joining us in the fall of 2022 to begin your journey as members of the class of 2028. Before we get started, I'd like to give my colleagues here the opportunity to introduce themselves. You'll be hearing from each of them as we go through the evening. I'm going to cover an overview of the Doctor of Pharmacy program, and then you'll get to hear from some of our students, and you'll also get to hear from our program director. So I'm going to turn it over to Dr. Mantione so she can introduce herself.
Good evening, everybody, and welcome. Congratulations on your acceptance to the PharmD program at St. John's University. I am a proud double alum of St. John's University College of Pharmacy and Health Sciences and currently serve as a clinical professor in the Department of Clinical Health Professions. My background is in community pharmacy practice, and I am also currently the director of the Doctor of Pharmacy program, and I work with Dr. Brokavich to keep the program running day to day. So welcome, and I look forward to speaking with you in a little while, where I'll be talking about some of our program's success stories, as well as some of our favorite and most successful alumni.
Hi, I'm a third-year pharmacy student. My name is Rhea. I'm from Cambridge, Mass. And congratulations to all of you for getting accepted. I'll be able to talk a bit about my experiences in the program and answer some of your questions from a student perspective. We also have people in the chat who will be able to help you with.
Good evening, everyone. My name is Yash. I'm from California. I'm currently in my 6th year of pharmacy program, about to graduate in May. So I'll kind of talk about my experiences from freshman year to now of graduation. And then if you guys have any questions from like transitioning from like out of state to New York, and then all the resources that were provided to me in completing this program successfully.
Great. Well, thank you all. So what we'd like to do is spend a little bit of time just to kind of go over and talk with you a little bit about what makes our program unique, what are some of the expectations for the program, and also to answer some of the common questions that we're always asked concerning the program here at St. John's. One of the things I think that's important to put out there is each of you have made a decision that pharmacy is the career path that you want to choose, and you're to be congratulated on that. With the changes and things that we've seen over the last 2 years with COVID, pursuing a career in the healthcare field is a challenging decision for anyone, and you're to be congratulated for making that decision as well. And having the opportunity to study here in New York is going to be a real opportunity for you as well as we move forward. So I want to thank you all for being here tonight, and I'm going to try to get started. And let's just hope that my slides change now when I click on them. Uh-oh. All right. So the first thing that I want to just quickly talk about is what are we looking for in individuals who are to become a pharmacist? First, we want to be able to have a desire to interact with and care for others. We want you to have this caring component to who you are, what it is you're trying to accomplish. Secondly, we're looking for individuals who have a strong interest in the sciences, not just from the basic sciences of things like biology and chemistry and math, but also the social sciences and also the clinical sciences. We're looking for individuals who have strong analytical and critical thinking skills. Those are the things that are going to make students successful. In becoming a primary care provider as a pharmacist, you're going to be making decisions each and every day that affect someone's life, either in preventing an adverse reaction or helping them to select the right medication, either as an over-the-counter product or speaking to other healthcare providers to improve the use of medications. Our job as pharmacists is to help patients to maximize drug efficacy and minimize the side effects associated with those medications. And that's what the 6 years of this program are designed to do for each and every one of you. To become a pharmacist, you also need to complete a pharmacy degree. Currently in the United States, the only pharmacy degree that is accredited for license to be able to sit for licensure is the Doctor of Pharmacy, or the PharmD degree. It is not a PhD degree. It is not a research degree. The purpose of the PharmD degree is not to help you to find the cure for cancer or COVID or some other disease process. We are going to train you to be primary care providers, to be medication experts, to use your knowledge and abilities to improve the use of the medications of the patients you serve, whether that's in the community setting, the hospital setting, long-term care, or any other setting that you may be working in. Okay. Just want to make sure my slides are changing. The slide has changed, right? Okay. I'm so confused. Sorry. And then the last thing about to become a pharmacist, the Doctor of Pharmacy degree does not make you a pharmacist. The pharmacist title is actually a regulatory title in each of the states in the United States. And after graduation, you need to sit for a licensure exam in the state in which you wish to practice. And you may wish to practice in a number of states and hold licenses in a number of states. That licensure exam, the passing of that licensure exam, is what allows you to use the term RPH, registered pharmacist, in that state. And that's when you truly become a pharmacist. The PharmD degree is the key to get you into being a pharmacist. Here at St. John's, we are a fully accredited Doctor of Pharmacy program. We were last visited by the Accreditation Council for Pharmacy Education in 2016. We are getting ready to launch our self-study to reevaluate our program. Dr. Mantione actually is going to be one of the people leading that self-study. So we're looking forward to that. And so as new students coming into the program in fall of 2022, you're going to be intricately involved with helping us to complete that self-study and also to meet with our accreditors in 2024 as we go through the self-study process and the evaluation process for the Doctor of Pharmacy program. Our program here at St. John's is a 6-year entry-level Doctor of Pharmacy degree. Unlike other schools that you may have looked at, our program has admitted you as a pharmacy major. The letter that you received says, congratulations, you are a member of the pharmacy program. So we're configured as a 06. That gives you the opportunity to be exposed much earlier to the concepts of pharmacy. We start talking about pharmacy the first day that you get here. And so you'll get exposure to pharmacy much earlier in the program than in other programs where you may not hear about pharmacy until you become a third-year student. The program is also a full-time course of study. In general, you're going to carry a credit load of about 15 to 18 credits every semester. That's a full load. That's a lot of work. The program is extremely rigid. It's extremely structured. I've had the opportunity to review all of your applications, so I know that each and every one of you are competent and capable of meeting the expectations of the program, much like our students that are with us tonight. Thirdly, it's important to realize that the Doctor of Pharmacy degree is a practice-oriented degree. It is not a research degree. Okay, the Doctor of Pharmacy degree is designed to help you either to directly or indirectly interact with patients and be able to improve the use of the medications that they're taking for their disease processes. So it's important to realize that a pharmacist is someone who's going to be utilizing their knowledge and abilities to improve the use of medications. It's not the person who's going to be working in a pharmaceutical company designing a new medication. If you have a career choice that you'd like to do that, you do have the opportunities to pursue graduate level studies for research, but that is not the focus of the Doctor of Pharmacy program. One of the other things I think that's important, and all of these things are going to be true, not just for us here at St. John's, but in any pharmacy program that you enroll in, is that a good part of the pharmacy program is going to focus on experiential learning. In New York State, after you complete your first professional year, which is year 3, you have the opportunity to become a pharmacy intern. And when you become a pharmacy intern, you can start to do whatever a pharmacist does, as long as there's a pharmacist present to direct you in those activities. From year 3 through year 6, you will complete over 1,800 hours of experiential learning. Those opportunities will be in community pharmacies, hospital pharmacies, in the pharmaceutical industry. You'll have depth and breadth that you will see in no other areas, probably, in terms of the career choices and exposure that you have in terms of the program. So a lot of students are always asking, where do I get my internships? They're built into the program. The opportunity to do experiential education with what we refer to as our introductory pharmacy practice experiences, as well as our advanced pharmacy practice experiences, which is where in the last year, you're out basically in the field 5 days a week, working a 40-hour work week at a practice site. All of those accrue to that over 1,800 hours of experience. The program is set up for you to learn theory, to evaluate that theory and apply that theory in applied settings, and then to put it into practice in your experiential rotations, so that you can actually see and help people who need those medications. And lastly, the thing that I mentioned earlier is that the Doctor of Pharmacy program is the only degree currently that's available out there that allows you to become a licensed pharmacist. You can't get a bachelor's degree in pharmacology and become a licensed pharmacist in the U.S. The only degree that's available today is the Doctor of Pharmacy program. For me, when I was sitting where you were sitting, the pharmacy degree was a bachelor's degree. But since 2000, all pharmacy programs have moved over to the entry-level PharmD degree. And in most cases, it's the equivalent time-wise of a 6-year commitment. And I'm sure that you're all aware of that and have had the opportunity to evaluate that over the time that you've been looking at schools. Some of the things that help to make us unique as a school. First, we are one of only 10 Catholic universities in the United States and the only Catholic Vincentian university that offers the Doctor of Pharmacy program. As such, we are connected to our Christian as well as our Vincentian missions. So we're looking to train people who are moral and ethical practitioners and who are committed to helping those who are underserved, the marginalized, people with health disparities. So we want to focus on helping those people through our Vincentian roots with the Congregation of the Mission, who run the university, to serve those who are marginalized in so many ways. And those two things are extremely important in the mission of the university, as also and also in the mission of the College of Pharmacy and Health Sciences. We are committed to academic service learning. All students in the Doctor of Pharmacy program will participate in academic service learning. What's the difference between community service and academic service learning? Academic service learning not only is doing something for someone else, it's also reflecting on how it affects you. How does it make you a better person? How does it make you a better practitioner? So academic service learning is extremely important and is very much built into our Vincentian mission as a university. So all pharmacy students participate in academic service learning. Thirdly, one of the other things I think that help to make us unique is we're one of 3 pharmacy schools that are located in New York City, the greatest city in the world. And New York City is an extension of our campus. You'll do your advanced pharmacy rotations, your introductory pharmacy rotations within the metropolitan area. That gives you the opportunity to interact with the millions of people who live in the New York City area. The depth and breadth of the things that you'll see and learn are going to be phenomenal. And the opportunities in terms of career choices are going to be much broader because of the types of activities and practices that exist within the New York City area. So location, I think, is extremely important, not just from the standpoint of your schooling, but also just from the standpoint of where you're going to be. There's no place like New York in terms of culture, in terms of if you're into dining, things that are close by. You can pretty much get to ski slopes in an hour. You can be on the beach in an hour. It's really the best of all worlds in terms of the opportunities that you have by coming to school here. Additionally, our program is entirely run out of our Queens campus, which is the easternmost borough of New York City. It is very residential. It's kind of suburban. So if you haven't had a chance to visit us, I would encourage you to come out and visit our campus and see the beautiful campus that we have. Our campus was actually built on a golf course in back in the 1950s, and we still have a lot of large open spaces. And if you haven't had a chance to visit us, I would say come in and visit us, since this is going to be a commitment that you're going to be making for 6 years, and seeing that, I think, is something that's important. I talked a little bit about it already, but it's also important to realize that you are directly enrolled in our Doctor of Pharmacy program. There is not a second application process. You're not a undecided major. You are a Doctor of Pharmacy program major right now with the letter that you received. We will start talking about pharmacy-related coursework the first semester that you're here. And I think that's something that's really important, in that you get that foundation of what pharmacy is about very early in the program. Additionally, we are affiliated with over 300 healthcare institutions, and we have well over 1,000 voluntary faculty, most of whom are pharmacists, who dedicate their time to the learning of our experiential students. You'll be able to work side by side with individuals who are not only state leaders, but national and international leaders, and not just from the standpoint of pharmacists, but also physicians, nurses, administrators in some of the greatest healthcare institutions and healthcare environments in the world. And you'll have the opportunity to do your rotations in those great places. And some of them are listed on the slide for you here. We have a dedicated and nationally recognized faculty. Our student to faculty ratio is about 10 students to 1 faculty member. We have over 80 dedicated faculty to the Doctor of Pharmacy program who are full-time funded by the university. So the people who are going to be teaching you are going to be full-time faculty. Our class sizes range from around 20 in our labs to about 50 in a classroom. We don't necessarily, except for our drugs and disease courses in 4th and 5th years, we don't have classes of 150, 200 students sitting in a classroom. We have smaller classes so faculty can interact with them, and those faculty are dedicated to your learning. And I think that's something that's important. In addition, our faculty serve as leaders within national pharmacy organizations. They are recognized research scientists doing cutting-edge bench research in our labs on campus as well. And we also have a number of pharmacy-dedicated spaces that allow our students to experience and put into action the things that you're learning in the classroom. So we have a patient assessment laboratory that has 2 sim men, where you actually go in and actually they have blood pressures, they breathe, they can talk to you. So you're getting the opportunity to practice your knowledge or apply your knowledge without necessarily being directly involved with the patient or having to worry about making a mistake with the patient. And there'll be faculty there with you to help you along the way. We have our own Rite Aid pharmacy lab, and there's a number of other resources that are available to you as pharmacy students that are specifically designed to help you to apply the skill sets that you're learning in the classroom and before you go out in those experiential rotations. From a curricular design standpoint, because we are a 06 program, we can start to talk about the profession of pharmacy much earlier. I have the privilege actually of teaching all freshmen for the entire first year. And it's a great thing. I really get so motivated every September when our new class comes in, and I see that the future of our profession is in good hands. The dedication, the commitment, the desire to make a difference as pharmacists is clearly there with the students who are entering our program in the fall of each year. It's important to realize that the university is, that as part of being part of the university, we do follow the university core curriculum. And those things are done over the first 2 years of the program. We focus on a strong abilities-based professional. My dog just left me. We want to make sure that you're going to have the abilities in terms of a strong liberal arts background so that you are successful as you enter the pharmacy program to become competent pharmacy practitioners. Because of the fact that we are a 06 and you do get the exposure, you will learn about pharmacy activities in years 1 and 2, where in many other schools, it may not be until your first professional year, year 3, that you start to talk about what a pharmacist does and what kind of skill sets are necessary. We utilize an integrated curricular approach, so students are taught by faculty based on their expertise in a particular area. And our program is designed to teach you how to manage patient outcomes. So it's about, is this the right drug for the right patient? Is it the right dose? Is there any possibility of toxicities? Can we do anything to improve the care of the patient that we're dealing with, either directly in front of us in a community pharmacy or a hospital pharmacy, or indirectly if you're working in an environment like the pharmaceutical industry? And one of the things that's important for us is that we want our program to be an abilities-based curriculum. We want you to be able to learn in the classroom and then to go into an abilities-based learning area and apply what it is you have learned in the classroom, to build capillaries between courses, to be able to allow you to say, well, I see where this course comes from and where this course comes from, and how do I build that into a stronger understanding of what I need to do as a pharmacist. So being an abilities-based curriculum allows you to learn things in theory in the classroom and then go to a laboratory or a recitation or an experiential site and actually apply it, where you can touch, feel, measure, observe, learn to understand exactly what it means to be a pharmacist. And I think that's one of the things that our curriculum does allow our students to do very well, is to get into the whole concept of not necessarily focusing on just memorization, but also getting to the point of understanding what are the steps necessary to be successful. The next thing that I would just like to touch on quickly, and you can certainly add any questions in the chat, and we'll try to address them at the end of our program tonight. But a third area I think that helps to make us unique is student opportunities. And there's really 4 that I'd like to highlight for you. First, pharmacy students can participate in the University Honors Program. The University Honors Program is an offer that comes with your acceptance. You, based on your academic record, can be asked to participate in our University Honors Program. And this is university-wide. It's not just in the pharmacy program in the College of Pharmacy and Health Sciences. The University Honors Program gives you the opportunity to work with some of the best and brightest faculty we have, to take advantage of smaller classes, to learn in different ways than just sitting in a class and taking a multiple choice exam. The University Honors Program is an area that if you're looking for that smaller class, more interactive kind of experience as part of your college experience, the University Honors Program might be for you. It's also important to realize that the University Honors Program, although it's for the entire university, almost half of the students enrolled in the University Honors Program are Doctor of Pharmacy students. And so there's a lot of opportunities, and many of our courses that are even pharmacy-specific liberal arts and science courses are available as honors courses within that program. A second thing that I think is important and that is truly unique to St. John's is that we do provide our pharmacy students the opportunity to study abroad. We have a program that's referred to as Western Pharmacy Europe. And in the spring semester of second year, you can actually spend your entire semester studying 5 weeks in Paris, 5 weeks in Rome, and then 5 weeks in Limerick, Ireland. And you'll complete 1 or 2 courses in each of the cities. A faculty member from here in Queens will actually travel with you. They'll teach you in the classrooms in those cities. You'll have the opportunity to get involved with academic service learning activities in each of those cities, and also get to experience the culture and professional development in each of those cities with our faculty member. At the end of the 5 weeks, students move on to their next city. The faculty member comes home, and a new faculty member greets them when they get to the next city. We have a group of in 2020 we had a group of students that were actually in Paris. They got to Rome. They were there for 2 days. We had to evacuate them. We didn't have a program last year, but I'm very happy to say that we have been able to restart our global program. And this year we have 12 students that are actually studying abroad. They completed their course in biochemistry in Paris, and they've now moved to Rome, and they're studying in Rome, and they'll be finishing up in Rome in 2 weeks and then moving on to Ireland. So it's a great opportunity. It's a great way to expand your horizons. One of the important things for us at St. John's is that we want our students to be good global citizens, and the opportunity to study abroad and to learn about other cultures, looking at diversity, all of those things are important to us, and you get that within the Doctor of Pharmacy program. Another advantage, I think, for the university is because we are part of the university, and because we have such a dedicated and active student population, is that there are a lot of different organizations and clubs that you can belong to. Across the university, there's something like 130 different clubs, organizations that may not have anything to do with pharmacy, but things that you have an interest in right now in high school. Chances are that club already exists here at St. John's. And you can keep that extracurricular passion of yours alive by getting involved with students either in the college or outside of the college as a member of the St. John's community. And I think that's one of the real advantages that exists when you look at a university setting like St. John's, that you do get to see those kind of opportunities. And then the last thing that I would mention in terms of student opportunities is that the college has an academic success center. And the Academic Success Center was created so that students can be successful. A part of the center focuses on tutoring. So we have tutors that can help at any level from years 1 through year 6. But in addition to the tutoring component, where students may be struggling with the particular topic area, we also have programming to help best and brightest students to see what other opportunities exist, what other career opportunities are out there, how to prepare for interviews, those types of things. So the Academic Success Center is something that's really important to us. It's mostly utilized by students in the 3rd, 4th, and 5th years. We're trying to get it back up and running. We've moved a lot of it into remote access for the last 2 years, but we're back on campus, and they're doing a great job with getting services and opportunities back up and running through our Academic Success Center. In terms of the program here at St. John's, as I mentioned, this is a 0-6 program, and you are pharmacy majors, but there are still progression milestones that you need to meet. Over the first 2 years, we are going to look at your overall grade point average, and to progress into the first professional year, you're going to need to have an overall grade point average of a 3.0 and a math science grade point average of at least a 3.0. Now, what does that convert to? That's a B average. And knowing where your grades are and what you've seen, all of you are well above a B average in high school right now. But it's a situation that across the first year and second year, by the time you get to spring semester of second year, we're going to be looking for your GPA to be at 3.030 in order to be able to meet the progression requirements to move on to the first professional year. In addition to the grade point average, we're also going to have you complete an interview with 2 faculty. We want to make sure that you're committed to our profession, that you understand what the next 4 years is going to look like. So you're going to spend a half an hour sitting down with 2 faculty members and having a conversation to learn or to discuss your views of what pharmacy is about. And we also are going to evaluate your writing capabilities. So communication is extremely important for us as we look at the career in pharmacy. You need to be able to correctly communicate orally as well as in writing effectively. And so we will be evaluating that at the end or in the spring semester of second year. As you move into the professional years, starting in third year, fourth year, fifth year, you will have to complete a criminal background check each year. And that background check is designed so that we can tell our clinical sites that you are not a risk for being involved with their patients or access to controlled substances, those types of things. So those things are done on an annual basis. Prior to starting the advanced pharmacy practice experiences in year 6, you will complete a fifth-year competency exam. It's a case-based exam. You're given a patient scenario, and you evaluate that patient and demonstrate that you are adequately prepared to care for a patient. In both the interviews, writing samples, or the competency exam, if there are any deficiencies, we will provide a remediation program for you so that you can make up whatever the deficiencies are and then be reevaluated. In the event that a student has an overall grade point average at the end of second year of less than 3.0, our college progression committee will meet with them and will come up with a plan, an academic success plan for those students in terms of how they can better improve their outcomes as they enter that first professional year. So not having a B average doesn't necessarily mean that you are not going to be promoted to the second year. We've already covered that. Okay. Some of the commonly asked questions that we get in these kind of sessions that I just wanted to kind of put out there, and we'll be happy to answer whatever other questions you may have. But the first question a lot of people hear about are, is there any plans to expand the pharmacy program to 7 years? We are right now in the middle of curricular revision. We're looking at the program and looking at how do we make sure that the program is still viable for students such as yourselves who will be joining our program. And so that program, that evaluation is ongoing. The program and everything that I've talked about tonight, and you'll hear from Dr. Mantione and from our students, is not going to change for your class. Your class has been admitted into a 06 program. That is exactly what your program is going to look like. Any changes that will occur will probably, at the earliest, be implemented in fall of 2023, probably more likely in fall of 2024. So all of you are accepted students for fall of 2022. So everything that you see on our website, everything we're talking about tonight is not going to change by the time you get here in September. Can students transfer into the pharmacy program? The answer is yes, if space permits. We do have an idea of how many students we can accommodate in our program. The pharmacy program at St. John's usually enrolls between 250 and 300 first-year pharmacy students. Over the last 2 years, that number has been a little bit smaller than that. And so we are actually recruiting transfer students into years 1 and 2 because of the fact that the enrollment was a little bit smaller. And a lot of that has to do with the COVID pandemic, as well as the number of students who are graduating from high school. Do you qualify for AP or high school extension courses? The answer is yes. Because our program is extremely rigid and structured, there's not a lot of opportunities here. There's not a lot of electives that take place, but you can earn AP credit or high school extension for English Lit or English Composition. If you're taking the AP exam, you would need to have a 4 on either composition or literature. You can also earn 3 credits for calculus or statistics if you earn an AP score of 5. We do not take AP credit for chemistry or biology. However, if you did take a college level chemistry course in high school for a full year, that would allow you not to have to take our first chemistry course in fall of 2022. The other courses that you may have in terms of AP, in terms of world history, languages, those types of things, they are not applicable to the major, so we can't grant credit for them. But they make you a stronger person and will help you to be more successful as you go through the program. A fourth question that's always asked is there assistance with career placement? And the answer to that is yes. We have a very active career services office within the university. And in fact, we have our own career services director within the College of Pharmacy and Health Sciences. And that individual actually gets involved with our students as early as the first as early as the first year. So you can have an opportunity to meet with career services to help you to identify how to prepare for an interview or write a CV or a resume, or even look for a job. We have a board called Handshake that does post both pharmacy and non-pharmacy career opportunities for individuals. So there's a lot of support that exists in terms of career placement while you're a student and also after graduation. One of the other questions people always ask is that what's the retention rate within our program? Our retention rate is very high because the students that are being brought in are coming in with extremely high credentials. The depth and breadth of the experiences you've had, the knowledge that you have is extremely high. And because of that, students who come here and have made the decision that pharmacy is for them, they do extremely well. Our first year retention rate is around 95%. Our graduation rate to on-time graduation rate is around 75%. So 3 out of 4 students who start with us in fall of 22 will graduate based on our projections, will graduate by May of 2028, which is well above the national average. It's also important to note that students who start with us as freshmen, about 85% of those students will progress on time to the first professional year. And you say, oh my God, 15% of the students didn't make it. 15% of our students who do leave us are students who may not have understood what pharmacy was about. They get here, they get that experience in the first 2 years and say, you know what, I may need to think about a different career choice. It's not a situation where they're leaving because they're struggling academically. They realize that pharmacy may not be for them. And that's the reason that we do see some attrition over the first 2 years. When we look at our national licensing exams, we come out very close to the national average. We are one of the largest pharmacy schools in the country and have the largest number of graduates who actually compare or complete the licensure exam. And so first-time takers for our students, they do very well in terms of the licensure exam. The NAPLEX exam, which is the primary licensing exam, has changed. And so the overall pass rates nationally have gone down over the last year or so. But overall, our students are still very competitive in terms of passing the licensing exams. Okay. I'm going to stop there. Are we good? And I'm going to turn the program over to Dr. Mantione. And Dr. Mantione is going to talk a little bit about some of our success stories and some of our other information. So, Dr. Mantione?
Thank you, Dr. Brokavich. Okay, that works. Again, welcome everybody. I'm excited to talk to you about some of our program success stories and happy to answer any questions that anybody has about our program. Wanted to start off just talking a little bit about one of the items that we track or that I track in my role as program director. Talk about postgraduate training and employment post-graduation. And in the last few years, you could see we've had well over 90% employment rates after 6 months. Our students generally are able to find good employment as pharmacists, as well as go on to some postgraduate training opportunities or maybe some even furthering their education in graduate programs. So one item, this is kind of fresh for us because it just happened last week where a lot of the students who are graduating this year who wish to pursue a residency, and I think Dr. Brokavich alluded or described a little bit about what a residency is. You don't need to do a residency to practice as a pharmacist. You graduate from the program and pass your licensing exams, register as a pharmacist, and then you're able to practice in a whole host of wonderful places where you can directly affect patient care and improve the quality of lives and participate in the medication distribution process and in our healthcare system. Some students do choose to further their clinical education by completing a residency, which is sort of like working, but under a preceptor that helps develop you and polish your clinical skills and prepares you maybe to do some research. And it's not exactly an extra year of school, and it's not exactly a pure year of practice. It's kind of like practicing as a pharmacist, but with a bit of a safety net and a strong mentoring and evaluation program to help make sure that you're ready to move on into the clinical realm of pharmacy practice. So a lot of our students do choose to pursue residencies. This year, we had our best residency match rate ever. We had 62 participants in the American Society of Health System Pharmacists match program, and 72.6% of them, or 45 of them, matched on the first round. We haven't gone through the second round yet for those that did not match, because sometimes programs and graduates do not match on the first round. So there's a couple of other rounds, but we were very excited to report that over 70% of our students in the match this year got a program. Many students that I heard from personally through text messages and emails sharing their excitement last week matched to their first choice. So we were really happy and proud of the success of the students that they're preparing next year to go on and continue their clinical development through a residency program. So I'll talk to you a little bit about one of the things I always try to do in any of our events about the program is talk about some of our fantastic alumni. Again, you'll meet so many different faculty, fellow students, administrators, and so forth. While you're in the program, we have wonderful opportunities for our students to be involved in our alumni mentoring program. And because we're a large program and because we're in New York, we have alumni, thousands upon thousands of alumni all over the country in pretty much every area of practice or use of the pharmacy degree is represented. And I'll just highlight a quick four that show some different opportunities for you once you graduate. Several of these alumni also serve as alumni mentors in our program and can be matched up with students as they go through to help develop them professionally, which is a very big aspect of the program, making sure that our students are getting all the knowledge and the skills to be pharmacists that they need, but also it's always important to get involved in organizations, to network and meet some of our alumni and make those connections, because oftentimes a simple conversation with somebody can change the course of your path. So this is Dr. Schmidt. He graduated in 2006, and he's one of our alumni that works in the pharmaceutical industry. He worked in several different places after graduation, including in community pharmacy, and then moving on into managed care. And he worked in the managed care space for quite some time. And he's currently the regional account manager in New York City for market access and public affairs for Novo Nordisk, which is a pharmaceutical company that makes a lot of the diabetes medications that you may see advertised on TV or be familiar with. So we have alumni. Many of our students do choose to go into the pharmaceutical industry. We help them, and we are affiliated with several fellowship programs, which help get a foot in the door, so to speak, after graduation through completing a fellowship. A graduate can go on and complete a fellowship in the pharmaceutical industry. So that's another area that we see a lot of our students, usually like 15 to 25 students each year from graduating class, go on to do some sort of fellowship program in the pharmaceutical industry. And we have a lot of really great connections with that industry being so close in New York City. Dr. Katie Semino is one of our more recent alumni. She was from the class of 2015. She represents in my little presentation here the institutional or hospital pharmacy practice. She has had tremendous success since graduating, working at New York Presbyterian Queens, which is a hospital that we have affiliation with that is right down the road from St. John's. And she's the senior pharmacist for intravenous compounding and research. So although she works in a hospital pharmacy, and there's many pharmacists that work to distribute the medications throughout the hospital system, Dr. Cimino actually oversees the entire research and the IV compounding practices at her hospital. So she has some administrative and managerial responsibilities, and she was absolutely critical in helping New York Presbyterian Queens face the COVID crisis when it first hit. And she also, throughout that process, being on the front line and working in the IV compounding and dosing all of the medications for the patients with COVID, she was also critical in helping us through the process because, as many of you experienced in school, we also kind of transitioned to an online learning environment for a short amount of time during COVID. And Dr. Cimino was able to do some remote learning right through the hospital so that our students getting their introductory pharmacy practice experiences would be able to still get that experience. And she was critical during that very stressful time for everybody. So lots of opportunities in the institutional pharmacy setting, clinical pharmacy opportunities, administrative opportunities. She also oversees all the research medications. So any research projects going on where they're studying the effects of certain medications in patients in the hospital that she works in, she oversees the preparation of all of those different medications because you can't really know what those medications are when you're studying them. So she has a pretty interesting and I think a pretty cool position. Hold on. Oh. Okay. This is Dr. Bosco, and I apologize. When I had them send me all their pictures, this was all happening towards the end of the pandemic, so everybody was still in masks. I'm going to have to reach out and get some new pictures from our lovely alumni here. Dr. Bosco was from the class of 2017, and he did the clinical pharmacy route. So he decided after he graduated to pursue a postgraduate residency training in institutional pharmacy practice, and then went on to do a second year of residency training because he really wanted to be a specialist, a clinical pharmacy specialist in infectious diseases. So again, he was very busy during the COVID pandemic. He works, now he currently works as the infectious disease manager and head of infectious disease pharmacy practice at NYU Langone, but he was previously over at Flushing Hospital Medical Center before transitioning to his new position. And then lastly, this is Dr. Gladys Garcia Duenas. She's from the class of 2007. I will say all of the alumni that I'm focusing on here happened to be alumni that I had the honor and privilege of precepting when they were pharmacy students. And that, one of the really nice things about teaching in a pharmacy program and hopefully about being a student in a pharmacy program like ours is how many of our alumni I still keep in regular contact with and follow after having been my student. And these are just four. There's many. That's one of the most rewarding things about working in a pharmacy program is the wonderful students that you come to know throughout the process and seeing them grow and go and get wonderful jobs after graduation and following them and keeping in contact with them. So Gladys from the class of 2007, she pursued a residency after graduation in community pharmacy. Similar, I also did the same thing, and she went on to then work as a faculty member at a college of pharmacy in Pennsylvania. But after a few years of doing that, she decided that she really wanted to make a difference by owning her own pharmacy. And one of the really nice things about New York and New York City in particular is the amount and the concentration of independent pharmacies that we have in the area. It's certainly not as common throughout the rest of the country to have so many independently owned pharmacies. They certainly exist in communities elsewhere, but in New York City, we have a pretty high volume of independent pharmacies in our area. So our students often get the opportunity to do experiential learning, both in a large chain setting. I happen to practice in a supermarket pharmacy. And then we also have lots of opportunities for students to rotate through independent pharmacies, which is a good opportunity, especially if you have an entrepreneurial goal or maybe want to start your own business. To be able to learn from a pharmacist who owns their own business is a wonderful thing. So Gladys owns Vienna Star Pharmacy actually she's in Pennsylvania in the Philadelphia area, but she has had wonderful success with her specialty pharmacy, serving the members of her community there. And she's been very, very successful. So that's all I really wanted to cover directly. Again, happy to answer, and I'll be in the chat looking at your questions and happy to answer any questions that you might have about being a pharmacist, licensure exams, or anything about our program. And I hope to welcome you all in September when you start your class. Thank you.
Thank you, Dr. Mantione. Great overview and great stories of our success with our alums. Moving along and trying to stay close to our timeline here, I'm going to turn the program over now to Rhea, and she's going to give you a little bit of an overview of her perception as a pharmacy student here. She's a third-year pharmacy student. Last night we had our white coat ceremony, or not last night, Saturday night we had our white coat ceremony, and welcomed her class into the first professional year. And so I'm going to stop there and turn the microphone.
Yes, hi everyone. I'm Rhea. I'm a third-year pharmacy student, which is my first professional year. So as Dr. Berkovich said, I just had a really exciting ceremony where we got to transition into our professional years, where we receive our first white coat, which is a huge thing in most healthcare professions. Just a few of my personal experiences as I've been here is I see a lot of people were talking in the chat, and Dr. Berkovich has mentioned it before, how we do have so many different opportunities on campus for different resources. As a student, you always are able to go to so many different people if you need any support. I have my advisor, I have a faculty mentor who is a professor in the college who I can speak to, who helps me to kind of look at what I want to do on a long-term basis in the school and when I graduate. There's also the Academic Success Center. There's the University Learning Commons, which offer tutoring, the Writing Center. There are so many resources if you ever need any help around campus. And talking about organizations, I'm involved with a few of our pharmacy organizations on campus. We have so many different organizations, and I don't think a lot of people realize when you're first going into pharmacy school how many different settings of pharmacy there is, because you think you'll hear a lot like, oh, so you're going to work at Walgreens or CVS, but as Dr. Mantione showed in her presentation, you can work in a hospital, you can work for the government and the FDA, you can work for health services, you could do a fellowship or a residency when you graduate. There are so many different opportunities, and our clubs kind of focus on certain specific practice settings. Like we have clubs related to industry pharmacy and different specialties in pharmacy. And I think that's something that I really liked here, is that from such an early age, they teach you about all of these different settings that you can practice in. So you can really start to kind of think about where you want to see yourself once you graduate. And it's not like I had to wait to finish undergrad and get a bachelor's or something and then go into my pharmacy practice. It's once you're starting in your first year, you're already starting to take courses that are related to pharmacy. And some of the courses are specific to St. John's that I don't think you'd see at other pharmacy schools. Like we take a theology of healthcare course, which relates to our Vincentian mission and us being a Catholic school, where you get to learn about how different religions can affect people's healthcare. And we also take an ethics in healthcare course, which is talking about cultural competency and how you should recognize patients' rights and different things like that. So I think I really appreciate how you learn how to be a well-rounded person as well as a well-rounded pharmacist while you're at St. John's. I think this school really shows you how to be the best pharmacist that you can be one day. And I know I feel like I could go on forever about how much I love this school, but I'm sure that Yash has a lot to say as well because he's a sixth year, so he's graduating this year. And I would love to answer any questions you guys have in the chat, and I hope to see you all next year. So yeah, I'll turn it over.
Thank you for that, Rhea. So my name's Yash. I'm currently a six-year pharmacy student. Like I said earlier, I'm graduating in May. And one thing I kind of want to touch base on about St. John's like pharmacy program was like all the opportunities and support I got. So like coming from all the way from California, coming to New York, I was like, whoa, this is gonna be a big change. It's gonna be a really big step in my future. And helping with that transition from like managing my workload with courses, I always had someone like on the side to help me. And that's something that I really enjoyed about St. John's was how each class has a minimum of just like 30 to 40 students from like freshman year to like our 6 year pharmacy program, besides like our drugs and disease courses. But with that being said, outside of the classroom, you also had teachers who were willing to have like office hours, and they were easily able to reach and get in contact with. And then not just even like professors, even like the dean's college dean office that we have, where you can meet with your counselors, you can meet with Dr. Brokavage, or anyone that you kind of wanted to just personally speak with and have any concerns. They were always there to kind of support you. So that's something that really got me through the 6 year program. So that's definitely a plus point of St. John's Pharmacy program that I didn't really see in other schools.
Yeah, and I think Yash and I have talked about this actually because, I he's obviously a few years older than me, but there's so many opportunities where you get to speak to other students in the program, and it's a very supportive program. I know a lot of STEM programs can be very competitive, but all of the students in your year you're going through it together. You support each other in your classes, and you'll see them all the time, especially in your first semester when your schedule is made for you, it'll be all pharmacy students. But then also when you get into your professional years, you'll take block scheduling. So all of your classes will be with the same people for that semester, which is really helpful if you're trying to form study groups or if you need a lab partner. But also just getting the opportunity, like when you join different organizations on campus, some of the organizations even have mentoring programs where an older member could mentor a younger kid in the pharmacy program. And you can always kind of ask for advice from older students in the program, and they're always very supportive, which I really appreciated. I know, especially when you're starting in your first year, it can be a little intimidating, but knowing that you have people who have your back and will support you is so important, in my opinion.
Just going, or kind of just going based off like Rhea said, a couple week or last week we kind of just had like acceptance students day in person, and we were kind of just talking like on after the program was over on how we're not really we're not competing for seats. So once you get enrolled into like the doctor of pharmacy program, freshman year all the way to the end of sixth year, everyone's there with you. You're going through the program together. So it's like everyone's very open to helping you out, forming study groups, and managing your coursework. Basically kind of studying, and you guys are all studying for the same test, since it's all structured like how Dr. Brokavich was saying, that every student's going to be going through the same exact course from the beginning to the end. So everyone's in the same class as you, but just maybe different days, different times. So you guys are all going through the same thing, so which allows you to form study groups, get the resources on campus, study together, ask questions. And we also have quiet study areas within the library where they have like whiteboards, computers. They sometimes even offer like free coffee during like midterms week, finals week, which I always took advantage of. So that was always a plus.
I forget the dogs. You can't, like, whenever they have little puppies in the library during exams, that just makes it all better. In my opinion, I feel like that's the best thing.
The puppies do make studying for finals easier.
They really do.
There's my puppy.
Aw.
He just came back to visit.
So cute. About how many days per week do you have classes? That really does depend on your schedule because it's not the same as in high school where you'll have classes every single day at the same times. We go by a Monday, Thursdays, you'll have the same schedule. Tuesday, Fridays, you'll have the same schedule. And then Wednesdays are a separate day. Like this year, or this semester, I have classes every day, Monday through Friday, but it's like today, Monday, I had 2 classes, and then tomorrow I have 2, but then Wednesday I only have 1. And I know I had one semester where I had a schedule where I had no classes on Mondays, and I think I got out really early on Fridays. So it really just depends on how you make your schedule. Like I know some people will like I right now I like to get out early with my classes. So I made my schedule start really early so I can get out and have more of my day free, while I know some people prefer afternoon classes or late evening classes. So it's not the same as in high school or anything, and it really depends by the semester.
Semester. And then kind of just going based off of like Rhea said, having that kind of like flexibility of like picking and choosing your blocks and your schedule or what time you kind of want classes, you get the opportunity so that you're not overwhelming yourself too. Like in one day you're not taking like 4 or 5 classes each, like hour, 2 hours long. You're basically breaking it up into like maybe 2 classes each, maybe 2 hours long with a break in between. So that kind of gives you the opportunity to like review your notes right after class, ask the professor if you have any questions, ask friends after class is over, and then transition into your later on class and then do the same exact thing. And then with that being said, how like Rhea said, she likes to finish her classes earlier. That gives you also the opportunity and time to participate in other organizations on campus, take on some work, real life work experiences of like working in like pharmacy, hospital pharmacy, basically kind of just being out there and gaining the most experiences and experiencing what you're learning in school and what it is really to be a pharmacist.
And just a couple other questions that have come in the chats. How many students are in a class? Our expectations in terms of enrollment is if everything were perfect, we'd probably be between 250 and 300. Expectation probably for the fall of 2022 is that we'll probably be between 220 and 250 students enrolled in fall of 2022. In terms of the class size, the class sizes, with the exception of our drugs and disease, which have recitations and laboratories, most of our classes are capped at about 50 students per section. So a class of 200 would have 4 sections of something like anatomy and physiology. Our labs are capped at no more than 24 students, and in that lab, there are usually a teaching fellow and up to 3 or 4 graduate assistants, and it's overseen by a faculty member. The other question that came in was in terms of online courses. Right now, because of the fact that pharmacy is a direct patient care course, we are all back on campus. There are a few courses that can be offered online, but for the most part, almost all of the curriculum from years 1 through year 6 are on campus face-to-face courses, and all of our labs have been back on campus since spring of 2021. So the expectation there are certain things in terms of assessment and measurement of skills that has to be done face to face, and that's especially true when it comes to that abilities based learning to be able to touch, feel, and measure. For the most part, we're almost entirely back on campus. We have one 4th-year course in drug information that is being taught online, and 1 or 2 electives, but everything else is face to face. There's a question about testing policies. I don't know, Ray or Yash, if you want to take a shot at that in terms of how often are tests administered.
Yeah, so that kind of depends on the professor you get. So like some professors like to have like weekly quizzes, kind of just like going over whatever material was covered within that week. And then I know some professors that I've had only have a midterm and a final, so that you will only have two tests, and then all throughout the other classes it's just kind of review and lecturing on new material.
Yeah, that's the same with a lot of my classes. I think usually with like major exams, you usually will probably have like three at the most in the semester. You might have quizzes in some of the classes, which can kind of guide you to know where you are. In labs, you'll often have more quizzes just because it's like each lab is a different, goes over different material. But when it comes to exams, you'll probably just have a few. And every professor also has office hours. So you can always go to your professors to check in and make sure you understand the material. Strongly suggest that because it's like one on one, or there might be another student there, but it's always time where you can get a better understanding of what you're learning about. And sometimes they'll explain to you if you have an exam and you didn't really understand material, you could ask them to go over your exam with you. I think like a huge thing you learn very quickly is not to be afraid to ask questions, because whatever question you have, another student in your class probably has the exact same question. And just like going and talking to your professors, letting your professors know who you are. I know Dr. Berkovich because I had him as a professor freshman year, and now I have him again in one of my electives. And I'm always asking questions in class. I think that's so important in my opinion.
Well, like Ray was saying, like not to be afraid of asking questions with your professor is very key on like succeeding and progressing throughout the program. And then also that you'll realize like from the first day you step onto campus to like the first class you take, you'll see how open everyone, like faculty, staff members, some of the adjunct professors, how willing and open they are so their students succeed. Like they really want you to succeed and they're there for you. And you're really you will see that as you progress through the through the program. They want you to succeed, so they'll do anything in their power to help you like pass, help you study, give you the resources that are on campus. So they'll guide you in the right path that you need in order to succeed. So that's something I really that kind of really stood out to me of St. John's.
And the study abroad application, I applied for that actually when I was going into I believe it's when you're going into your second year, because it's the
First year.
second year. You're going, well, you
So,
pass.
yeah, I can answer that one for you, Ray. So the way that the study abroad program, because we want you to be able to make a good decision, we actually bring our study abroad colleagues in first year spring semester. And so we go over with you what the study abroad program looks like, what the expectations are, what the application looks like. We open the application a year in advance. And part of the reason we do that is that in that spring semester of second year, one of the courses that you have to be taking is metaphysics. And so we need to make sure in the fall, if you were supposed to take metaphysics, that you switch it out with the theology course, so that you're in line with the right courses when you go to Europe. So we actually start very early in the study abroad program. So we actually are meeting with our first year students starting on Wednesday. This Wednesday, Thursday, and then next Tuesday, we will meet with our freshmen and go over the entire study abroad program. And then April 1st, we will open the application for study abroad for January of 2023. So it gives you a chance to kind of talk about, spend some time with your family talking about the issues, um, and be able to really make a good decision. We continue to accept applications all the way up until October. Although the majority of students get their applications in quickly, and we can accommodate up to 60 students, 60, in our study abroad program. And in fact, we've actually run our program as a 3-city tour, as well as having a group of students who've just studied in Rome for the entire semester. The other thing that I just wanted to mention to highlight also, as Rhea and Yash had mentioned, as a faculty member and support processes, all faculty are required to have office hours. And we need to be available for students. And trust me, it's a very lonely 3 hours each week because I sit there and wait for students to come to see me. And a lot of times they don't. But we've also moved into utilizing, there have been a lot of bad things that have come out of COVID, but I think the opportunity to learn how to use remote platforms such as this allows us to even have remote office hours now for faculty, so that there is actually a great opportunity to interact, not just face-to-face in an office, but also through WebEx or Zoom or one of these other types of processes. So there's a question about how difficult it is to get to high grades. I don't know if someone wants to tackle that one.
So I mean, it's not difficult at all on getting good grades. It definitely depends on like the type of person you are and how dedicated you are to study. Like you said, like if you put in the work, the grades are gonna show. And like how Ray was mentioning, it is some courses will be difficult to get A's, and it's important not to get discouraged from it. Um, as like this is a doctorate program, the courses are rigorous, they are challenging, they are meant to be challenging. They help you think outside the box, develop your clinical and critical thinking skills. But like I said, if you manage your time, you put in the work, you put in the time, you dedicate yourself to studying, reviewing your notes, take good notes, ask for help, go to office hours. You'll see that your grades will always be up there. You'll always manage to pull off some A's, A minus. So definitely just it's based off on the type of student you are and willingness you are, the willingness you are to put in the work.
Yeah, and it's also something that you learn a lot is that it's really important that you understand the material more than just getting A's, because this is like, it's not just like a course you're taking, like some of the courses you took in high school. Like I know I wasn't really a big history person, so I was like, okay, I just want to get a good grade. The material you're learning is crucial to what you're going to be doing and how you're going to be taking care of patients. So understanding the material you're learning and knowing how to apply it in practice settings is so important, and can be more important than just getting the A. So like you have to kind of take that with a grain of salt when it comes to getting good grades, and make sure that you're able to like talk to your professors and have study groups. Make sure that you're constantly, like, I think you'll learn how to study better. I know that in high school I didn't really study a lot, but you have to learn how to study and study regularly. Don't just study the weekend before the exam, and that really helps you to get better.
And one of the other things I think that's important to always keep in mind is that coming or going to college is not just about grades. It's about becoming an adult and a functional adult. So you need to also get involved with the other things that are going on campus, not just what's going on in the classroom. It's easy to get lost. It's easy to get to just kind of focus on the courses. But one of the important things I think that you get, and I think you've heard it from both Yash and Rhea, is that you need to have a work-life balance. It's not all about what you're doing in the classroom. You need to relax. You need to have friends. You need to get exercise. You need to do all of those things to be successful. And that's going to be true whether you come to St. John's or go to another school. But you need to be cognizant of the fact that work-life balance is extremely important. We have another question dealing with study abroad. Can you study in other years beyond second year? Not really in terms, I mean, you could do a summer abroad, but those courses tend not to be applicable to the pharmacy program. You can get involved with the Global Passport program, which is a week either before the semester starts or after it starts in freshman year, linked to one of the English courses. But that's a very concentrated program that only runs for about a week. The true semester program is really in second year, spring semester. We have in the past run pharmacy electives in Rome. We would love to get those back up and running again in one of the off months that students would have from experiential education. But for many students, being able to balance that has been kind of difficult. We haven't looked at that for a while, but we may go back to looking at it. Especially, I've made a commitment to Ray's class that we'll figure out a way to get them to study abroad between now and the time they graduate, and that may be something we can look at again in that 6th year, is to spend a month in Rome. But right now, the real place that it's being done is in 2nd year.
Also,
Go to Rome. Okay.
Second year is kind of the perfect time to go abroad because it's before you start your professional years, which is when the classes get a lot more difficult and a lot more focused mainly on pharmacy. So it's kind of a nice little, it's not really a vacation because you are taking classes, but it's a nice time to do it when I feel like in the next years you're usually more involved with potentially interning or a lot stronger classes. And I think you kind of want more free time when you're going abroad. You kind of get to go out and do a ton of stuff. I know people who are abroad right now and are having a wonderful time.
We have a question about when the first semester ends and second semester begins. I think our last day of classes is the 9th of December. Then we have 2 study days. I think final exams start the 11th and wrap up by like the 17th or 18th of December. And then we don't return back on campus with classes until January, whatever the Wednesday after Martin Luther King Day is. Usually it's around January 20th. There's a question about what's your favorite class. I guess that would be addressed to Yash and Rhea.
So honestly, like in my opinion, my favorite class that I kind of took all throughout the 6 years with a pharmacy school was sim lab, and what that is it kind of puts you in a real life setting of a patient. So every week you'll get a new patient case with a new drug based on like whatever drugs and disease courses you're taking at that time, and they teach you basically on how to counsel as a pharmacist, and that's what's important as a career is you understand what the medication is used for, but then can you relay that information to a patient so they know how to take that medication safely and effectively. And I think we mentioned it earlier how within SimLab we have 2 SimMans, which kind of mock different type of settings. So it can have heart failure, could have like different uh, blood pressures, and within that lab, it teaches you on how to learn or whatever you learned in your courses is to apply it. So I really enjoyed this course because you have room for error, but you get to learn. They guide you like this is what you would want to do in this type of setting, or this is what you want to do if this happens. So it's like you're not out in the real world where you're reliable for your actions. But within this lab, if you make a mistake, it's okay because it's on a sim mem. It's not a real life human being. And it's actually pretty cool too. So it's like it does like a bunch of mock simulations. So it's like the patient could have like severely high blood pressure, and you get to actually measure that and tell the patient, okay, so you have high blood pressure. What are some counseling points you would want to recommend for this patient? So it's like this course is more practical than all of the other courses. Instead of just like sitting in a classroom listening to lectures, taking a test, this course is more based on taking all those other classes and then applying it in real life situation.
So I have 2. The first one, I don't want to sound like a kiss up saying this, but I really like my leadership electives that I take with Dr. Burkovich. We've gotten to learn a lot about just kind of yourself as an individual and how you work with other people because you have a team that you work on a project with all semester. It's a research project. Ours is about interprofessional education and how to work with other healthcare programs in the school. So I thought I think it's really interesting. And we've gotten to do a ton of really fun team building activities. And it's just a really fun class. Like, I think if you come to St. John's, and I'm telling Melissa this too, because she's a second year, she's in the chat, you should take that elective. I think it's really fun. I know Yash took it also. And then I also really like a course I take right now, which is experiential pharmacy, because kind of like Yash said, it's a lot of the practical parts of pharmacy where you're getting to kind of learn how to do certain things, like go through an electronic health record, or interact with, like, potentially make a call to a doctor. And that one also deals with interprofessional education, where I've gotten to interview a PA student, which is a physician's associate or physician's assistant program at our school. And I know some of my friends interviewed kids in our radiology program, and you get to kind of see how, though we're different forms of healthcare professionals, we're all kind of working together to work to help the patient. And I think that's something that's really important that they really stress to you on this program. And I see there's a question about, I don't want to miss it, but about if they discuss in the program stuff about like opportunities to open an independent pharmacy. We do have in a few of our different classes, like specifically our clinical pharmacy practice classes, we have different classes that are centered on different practice settings of pharmacy. So we do talk about independent community pharmacy, as well as chain community, hospital pharmacy, industry pharmacy, nuclear pharmacy. So you'll definitely learn about how different practice settings work. And like Dr. Mantione said, you can do a rotation in an independent pharmacy and get to work alongside an independent pharmacist and learn more right there about how that works.
Offer that too. Like we also have like co-curriculars that we do, and there's several co-curriculars that you have the opportunity to participate in, and some of them are based on like different settings in pharmacy. So it'd be I know like one of them was like based on like independent setting, and like how COVID was a big factor in it, how they were providing for COVID vaccines in like an independent setting. That was like the most recent one that I went to in like February. So like you'll see like how throughout the year, like whatever you wish to do, there's already something on campus for it. You kind of just have to reach out and just seek like, hey, this is something I'm interested in. I want to take part. How can I get involved? And like you'll see, everyone's very willing to help you out. You just kind of have to take the initiative to do it. And then I see another question of are all the courses from years 1 to 6 taken with other pharmacy students? So they are. Freshman year and sophomore year, you'll kind of see how you'll get some courses. You'll take some courses like some other students, like in biochem or chem majors. But then once you start getting into your more professional courses, like years 3 to year 6, they'll all be pharmacy students. And that's why, and it's really helpful on how it helps you manage your study groups, having those like same students within all your same classes. You get to see how one person might understand something where you might not. So when you do study together, you are kind of like teaching each other, and then and it's a great experience too. It's like you guys all go through the same thing together. So definitely, like even Rhea could speak on that experience too. How like the week before they were studying for like a really big exam for D&Ds, and they were all forming like study groups. Everyone's just reaching out to older kids, like, hey, what does this mean? How does this affect this drug, or how does drug work? What are we supposed to expect? So it's like even though within your same year, you'll see how you'll make friends even younger than you as well as older than you as well, and you kind of get experiences from both sides of the spectrum.
Thank you. It seems that we've reached the end of our time, which is kind of tough because we're having such a great conversation. There was one other question about how many electives are you required to take. Basically within the pharmacy program, you will do a 1 2-credit elective and 2 3-credit electives, 1 in third year and then 2 in fifth year. But we've, I think, come to the end of our time here, unfortunately. I'd like to give our panel 30 seconds for any closing comments or that you might want to share with our accepted students here before we close up. So unfortunately, it seems that the live session, the chat is closed down. I'm hoping the live session, in terms of that I'm not talking to the 4 of us here now, but Dr. Mantione, do you have any closing comments that you'd like to make?
Just want to wish everybody the best of luck and hope to see you in September when you join the PharmD program at St. John's University.
If you do use the Unibuddy platform, you can also message me, as I am one of the ambassadors listed. So you can ask me any questions related to pharmacy or any other questions about St. John's. And if you see me on campus in September, please don't hesitate to say hi. I love to talk.
I just want to wish everyone best of luck. We do really wish to see you in September. I will be graduated, but if anything, you guys could always just reach out to Rhea. Like I said, you guys do use this platform. You guys could just message on there directly, and we're always really helpful. Really glad to help you guys out.
And Oliver is giving you his comments right now. Well, I want to thank each and every one of our panel. They did a phenomenal job. I think they gave you a really good feel for what the program here at St. John's is like. Again, I encourage you that if you can, come and visit us. I know some people, I saw one person said that they were from Chicago. But if you do have the opportunity to join us, please do come and visit us on campus. It's a great experience, and you get to meet a lot of students, just like Rhea and Yash, and get to meet them. And again, this is going to be your home for the next 6 years. Wherever you're going to go to pharmacy school, you're going to get a great education. What really is important is, where do you fit? And if commitments to service, if commitments to studying abroad, being a global citizen, getting the metropolitan experience all fit in your goals, we hope to see you in the fall. I know this is a very difficult time for all of you in terms of making this decision. Some of you may have already made the decision in terms of where you're going and have decided to come here, and I look forward to working with you in the fall. For those of you that still have questions, please reach out to myself or to Lisa Sayo. Unfortunately, I can't get Lisa's email up there. But if you go to our website and type in Lisa Sayo, her last name is Sayo. She's the assistant director for the pharmacy program within admissions, and she can be more than happy to help you to make things work. Enjoy the rest of senior year. You've earned the right, after what we've gone through for the 2 years, to really enjoy this last couple of months of your high school career. It's a very important time. Take advantage of it, enjoy it, and our hope is that you do decide to join us here in the fall, and it will be a great journey for you as you go forward. I want to also recognize and thank Lisa Sayo, who's been in the chat, Melissa, who's also been one of our second-year students who's been helping us out with the chat, and also Corinne Gentile, who's the person in charge of setting up these events and making these things so successful. So on behalf of everyone here tonight, thank you all for being here. Thank you for listening, and that your interest in St. John's continues. And again, if you have questions, if you want to visit a class, please reach out to Lisa. We'll be more than happy to help you make sure that the decision you make is the best one that you can make. So on behalf of myself, our students, Dr. Mantillon, thank you. I want to thank them again. They did a phenomenal job. Always so impressed with the students and what they have to say. And the best part, well, no, it's not the best part, but I don't even pay them to say these things. So they speak from the heart. And I think that that's a true attestation of the commitment and love of our students for our program. So on behalf of everyone here, enjoy senior year. If you have questions, reach out, but we're here to help you. We also have Accepted Student Day, University Accepted Student Day, which will be April 9th. And you can find information on that on the university admissions website. So on behalf of my colleagues here, thank you. And I want to wish everybody well as we come to the end of our program tonight. So thank you, everybody. Great job.